good morning. Today we're going to be doing an educational video on how to do trach suction. I'm going to begin by coming into the room and introducing myself to the patient, letting him know what we're going to be doing. I'm going to want to identify my patient. I want to identify him by his name, date of birth, and also check the records for an order. Well, check his chart for an order. I'm going to verify allergies. I'm going to assess my patient. I'm going to assess him for pain. And I'm going to start by doing hand hygiene as well. I'm going to get all my supplies gathered, which for this I will be needing a suction kit, which we have right here. I'll be needing saline. My saline, I'm going to verify the expiration date, the time and date it was open. If it's a new bottle, I will do those things. I will initial it, date it, and look at the expiration date. I'm also going to need sterile gloves, which I have right here. And we're going to need a suction, which we have set up over here. I'm going to turn it on to continuous. And we want to make sure it's no more than 150. We can do that by plugging it and looking at the number here. So that's a good number for us there. So I'll leave it there. I'll leave this here ready for use. And then I'm going to start by opening my supplies. So this is the suction kit. I would bring this out, and this would have to stay in here, stay sterile. If it came out like it did now, I would get a new kit. When I get this, I want to make sure that I am only touching the bottom edges and not the plastic because it is sterile. So we're going to open it by the edges very carefully and place it there. I'm going to toss this, and then I'm going to proceed to open my sterile packaging by the edges only because it is sterile and we want to keep it that way. So again, edges only. Okay. So once that is open and we have that, I'm going to go ahead and open the saline. I'm going to pour a little bit out. Actually, I'm going to do this up here just to keep everything sterile. Pour a little bit out. I'm going to pour this in here. I'm going to place this over here. So okay, now that I have all these things ready, set to go, I'm going to go ahead and take off my gloves. I'm going to do hand hygiene again. Okay. So for this part, it's just opening my sterile gloves. We want to only touch the edges. So I'm going to start here by putting on this glove, only touching the cuff. And then I'm going to go and put this one on, going inside of the cuff, separating the edges so that my hand can get in there, pulling it all the way on. Now that I have both on, I can adjust this one as well from the inside. Alright, so now I'm going to designate this hand to be my clean hand, and this hand's going to be my sterile hand. Right now they're both sterile. I'm reaching in to get my tube. This is what this looks like. This part right here will be attached to the suction, and this part right here is what I'm going to use to suction the inside of the trach. So I'm going to go ahead and designate my clean hand here, grab my suction tube and insert it just like that. This part right here is what I'm going to use to plug so that it can suction, and I'm going to let go of that intermittently when I go in. Going in, I want to make sure that I'm not suctioning, so I'm going to let go of that. We're going to take our tube. We're gonna let our patient know what we're gonna do. We're gonna go in. So once we're in, now I can start suctioning. So I'm gonna start by doing like this, and I can do this too. Okay, and then once that's out, I'm gonna go ahead and bring it to the saline water and add suction. I would have an assistant here with a ambu bag, and I would ask my assistant to hyperventilate my patient 2 times before going in again. So pretending that my assistant has helped me hyperventilate my patient and that I've cleared my secretions from my tube, I would go in again. So let go of this part, go in, and start suctioning in a circular motion and outward simultaneously. Okay? Once again, I would ask my assistant to hyperventilate my patient 2 times. I would go in for a 3rd and final time. We want to make sure that this part is not done more than 3 times and no more than 15 seconds. Okay? So once again, I would clear my tube, and now we are all done. So I would kind of just remove this here, turn off my suction, and get rid of all my supplies, throw it away. Now the final steps is I want to check in with my patient. I want to see how he tolerated the procedure. I want to ask him if he has any pain, make sure that I'm assisting him with that pain. If he needs anything for pain, give him some pain medication. The secretions, I want to document the amount, the color, the consistency, and how my patient tolerated the procedure. And that is it for trach suction.